So, first of all, thanks for inviting me, and thanks to my parents mainly. Srinivasu and Dakshini are my parents. I'm doing infectious diseases in Montefiore in the Bronx, and I did my internal medicine residency in Stanford in Connecticut and my medical school training in St. George's. So I just wanted to go over a few topics that might help everybody today. So these are the things that I'll go over: background, what's happening now, prevention, treatments, vaccine, and some useful resources that everybody can access even after I'm done. So background, what is COVID? So actually the MERS SARS viruses ke chala similar. So they're cousins basically. And initially when it started, oka animal reservoir nunchi start anamata. And the reason why COVID-19 పేరుందుకు వచ్చిందంటే coronavirus disease 2019. So that's what it stands for. And it initially started in Wuhan, China in December. And obviously, March 11th, as you all know, is when the pandemic was declared. This is one of my favorite probably graphs that I look at every day. Um, I'm not a fan of the numbers, but this is just briefly to go over. On the top left, we have 2 million cases across the entire globe. US is leading in this, not in a good way. And the total deaths are 128,000. And we are continuing to test, and more people are just dying each day. So this is updated as of this morning at 9 o'clock. So most common questions everybody asks me, "Ela vastundi COVID? How do you get it?" And it's spread person to person. And I know there's a lot of things about getting it from animals and some other ways, but it can only be transmitted person to person. And within 6 feet is the distance that you can get. So everana tumina, dagina, or even if they're talking, because when you talk, you also have respiratory droplets that go through. So that can land in the other person's nose and the mouth, and then that can be inhaled in the lungs. And that's how you get a pneumonia from COVID. People without any symptoms can actually spread it. That's because every disease has an incubation period, which means that the virus hits your lungs and then it stays there. It has a party, it's growing, and it can be anywhere from 2 days to 14 days. So if you meet somebody on day 3 and they haven't had symptoms on day 5, they can still give it. So what are the symptoms? So fever, cough, shortness of breath, and you can also have diarrhea. It can start as a sore throat, very similar to a flu. And we're also seeing people lose their sense of taste and smell. And patients who come to the hospital have severe symptoms. So this is the pneumonia, which means the entire lung is infected. Severe acute respiratory syndrome, kidney failure, and you can also have death. So is there certain populations that are more severe for this? And greater than 65 years, Walaki, they're much higher risk compared to everybody else. So we've noticed that 8 out of 10 deaths in the US have been in this age range. And these are just some statistics. So 31 to 59% are in 65 to 84 years of age are in the hospital. 11 to 31% of them are admitted to the ICU, which means they're even more severe than the hospital. And 4 to 11% of these people have died. So if you have asthma, it can start as an asthma attack and then it can lead to a pneumonia because your lungs are already a little bit more fragile than usual. Medical conditions, interestingly, obesity is one of the biggest factors that makes COVID worse. Diabetes, chronic kidney disease, liver disease, heart disease, any smoking, HIV, or if you're on steroids for any medical conditions, it will be a much severe disease. And patients who are in nursing home or they live in a long-term facility, they also have a higher risk for getting very severe illness. What about pregnancy? So same risk. Actually, pregnancy patients need regular patients compare చేశారు, and it was the same risk as like any other patient. But the pregnancy body undergoes a lot of changes. So there's increased risk in some infections with pregnancy, and there's a higher risk of general illnesses that are related to COVID. So COVID is part of a family. So there's other viruses that are similar to it, or the flu. So those in those ways, pregnant women can get sick. So what should pregnant women do that's special or different? They should completely avoid sick people. Of course, that's like the number one thing that we preach to everybody, and clean and disinfect every surface that's touched. And I have a link at the end for more details on this, for people who want to share with people who are pregnant, trying to get pregnant, just questions. So what happens to mother to child? Can you give it to a child? Transmission through pregnancy is actually not likely. We haven't seen any cases of that. It's not really possible. So when the mom is pregnant with sick, she could maybe develop antibodies and give it to the newborn, just like any other infection. But there's no risk of the virus really getting in that we know of. And after the newborn is born, the risk from person to person is still there, because that's how it spread. Breastfeeding is safe, and COVID hasn't been detected in breast milk, so that's safe. And if the mother's sick, just have to wear a face mask and wash hands before each feed. Maintain like a breast milk supply, and also proper pump cleaning is important. So I just want to briefly touch on all of that, but I have a lot more information if you need on this topic. So one big question I ask is, how do I prevent this disease? I don't want it. Nobody wants it. Like I said, first thing you need to do is clean your hands. That doesn't mean that you clean your hands every time you think about cleaning your hands, but when you go out in public places, or when you touch your nose, when you touch your face, after you've coughed or you sneezed, that's when you really need to go and wash. And it's at least 20 seconds. So it's happy birthday, or you sing A through Z, the song, if you want to be very, very particular about it. And soap and water is the most important thing. Nothing beats soap and water. If you don't have soap and water that's readily accessible, use hand sanitizer, at least 60% alcohol. So you can check the bottle, turn it around, see how much percentage of alcohol is in there. So avoid touching your eyes, nose, and mouth with unwashed hands. I know this is not commonly done, but we all just have to be careful and mindful about this. Avoid close contact, avoid sick people, stay home, and distance between yourself and other people if you are sick. Stay home as much as you can. Stock on necessary supplies. Don't buy anything that you need over the top. Avoid any non-essential travel. If there's no reason to go, or a dire reason to go, avoid it at all costs. If you have any concerns about how to go about this, you should call your doctor. And there is a CDC thorough home disinfection for people who just want to know, where do I clean, what do I clean, how do I clean, what disinfection should I use. There's a link on all those details, which I'll provide. And this is kind of what it looks like. So let's talk about face masks. So everybody wants to cover their face. What face mask should they use? Where should you get it from? When should you use it? So recommended by CDC to wear in public settings. It can be homemade for people who are not healthcare professionals. You can make it. There is a link I included at the end on directions on how to make it. So the mask has to be snug. It has to be comfortable. It has to cover the entire top of the face and bottom of the face, and the ties should be around the ear loops. And it has to be multiple layers of fabric, so that's the barrier for protection of the droplets going through. And it has to allow you to breathe. Obviously, you don't want to be inhibited by breathing if you're wearing a mask. That defeats the purpose. And you should be able to wash it, and it should not really change the shape of it once you wash. And do not use surgical masks or N95. If you don't know what these mean, that's great. That means you're not using it. If you know what they mean, and you have it, try to donate it. If you're not an essential healthcare worker, there's really no reason to use it. It's you can make these at home. They're very easy. We're all very good at making things. So most important prevention is social distance. Like I said, it's spread by droplets, so obviously distancing ourselves will prevent the disease from getting in. So now I want to talk about what if you have COVID? What if you think you have it? What if you have symptoms? Stay home except to get medical care. So stay in touch with your doctor. There's hotlines for each state. There's hotlines for each community, or even your own doctor will have a hotline. Talk to them and describe your symptoms to them. Make sure you immediately separate yourself from other people and your pets. So find a room that's separate, separate bathroom if you can, or make sure that you have like a certain area that you stick to. And the things to monitor, like I mentioned, are fever, sore throat, cough, shortness of breath, loss of taste and sensation. So all these symptoms, you just have to monitor every day how you're doing, if it's getting better, worse, and discuss with your doctor. Make sure you're wearing a face cloth when you're around people. Like let's say you're coming out to have dinner or something like that. You make sure you're at least 6 feet away from them. Cover all your coughs and sneezes. Don't share any personal household items. So this includes dishes, glasses, cups, utensils, towels, bedding. And clean your hands often. And clean all high touch surfaces. So this is where the virus actually sticks around. Studies have shown that it stays 72 hours on plastic, at least 24 hours on cardboard, about 2 days, so like about 48 hours on steel. So it can live there for a long time, and if you don't clean it, it'll live even longer. So it's just important to clean these surfaces. And more information if you need at the end for a link. So when do you go to the hospital? When do you know you're dying? When do you really need to go get medical treatment? If you have difficulty breathing. So with COVID pneumonia, you will have a little bit, but if you can't stand up and you're really short of breath, you start getting dizzy, that's when you need to go call 911. If you have pain in your chest or pressure in the chest that's not going away, if you have some new confusion, and this is not obviously noticed by you, your spouses might notice it, your housemates might notice it, they're not really waking up, they're really drowsy, call 911. If their lips turn blue, or you're starting to see some bluish color, or their face is starting to turn blue, that's when you call 911. So these are all emergency warnings that all of us can identify and call 911. So let's hope that you don't get all of that and you only get mild symptoms. When do you stop? When do you stop this house arrest of in your house in a corner? If you didn't have a test for COVID, because not everyone is getting tested, and I'll go into that in a second. So if you go 72 hours without a fever, your symptoms have improved, or at least 7 days since your symptoms have started. Whichever is longest, that's when that's the day that you can basically come out. If you had a test, call your doctor. They're going to give you more specific instructions on when to come out of isolation. So testing, who needs it? Not everyone needs it. That's because we have a shortage of tests. The status of that is improving overall, globally, locally, and in the US. So we are reserving testing to people who really, really need it. And most people have mild illness. Whether you are watching news where there's a lot of people who are dying, even I presented the stats to you, yes, there's a lot of deaths related to it. But most people, 70 to 80%, have mild illness, which is good, which means that you should be able to stay home. You can just let the illness pass by, spend time with their family, be sick, stay, rest, and it should go away. But you can obviously talk all this with your doctor directly if you feel like you're not sure what to do. So there are drive-through testing that are more available. Obviously, I'm in New York, so I know a lot more about what's going on here. They have just drive up through the window. If you have symptoms, they're able to swab and test you. And it is a nasal swab, and it tests the virus. So whether you can get testing or not is really how much is really available in your community. So let's talk about treatment. Everyone wants to know how is this treated? What are we doing with patients in the hospital? What about patients who are just at home? So, like I said, mild symptoms, no additional medications besides keeping your fever down, keeping your pain down, cough syrup, um, just like regular symptoms of a cold that you would have, just manage it that you would have. But if you have moderate to severe symptoms, that's when hydroxychloroquine is recommended for 5 to 10 days. And this is a medication, you might have heard Plaquenil, that's the name of it usually used for other diseases. And it's been shown to help shorten the symptom duration and also improve the symptoms recover quickly. So that's what we are using for all patients in the hospital. Um, a word on azithromycin, because I know our president did mention it, and we actually looked at the data of azithromycin. It's also known as a Z-Pack, if you heard it, commonly prescribed outpatient, and it's really not recommended. The data is not strong enough to say like, hey, this is going to help the patient. And there are some clinical trials that we're doing for all different medications. So this is a bit technical, but I just want to touch on it with one slide on what I am doing every day, on what I enroll patients in. Remdesivir is the #1 medication that we evaluate for. There are randomized placebo-controlled trials for that. There's also monoclonal antibodies, the tocilizumab and saralimab. All you need to know is that it basically calms down the immune system, because our immune system is reacting crazy when it sees this virus. So more than the virus, your immune system is actually causing a lot of fevers, a lot of shortness of breath, a lot of damage to the lungs. So we've been trying that medication on a lot of patients who have those symptoms. And last but not least, the convalescent plasma, which is very interesting. So if you have fully recovered from COVID, you may be able to help patients currently fight the infection by donating your plasma. So how this works is a COVID patient on the left has it, they recover, and then they can go to a blood bank where they can withdraw blood from you. They take the um, blood and, excuse me one second. So they take the blood. Your blood made antibodies against this virus already. So you have that immune system if you recovered from it. And they take that serum and inject it to patients who can get it for prophylaxis theoretically or treatment. And we want to start with treatment because there's patients dying now. And we want to start there and work our way backwards. How do we know if this even helps? Why is this exciting? So we actually used it in a lot of epidemics and pandemics before. So SARS epidemic in 2003, we used it. H1N1 pandemic in 2009 to 2010, we used it, and 2012 when they had the MERS epidemic. Not so much here in America, but where it was an epicenter, they used it. So the data for convalescent plasma for COVID, Wuhan in China, they actually have tried it in very severe or life-threatening disease patients, and they gave one single dose, which was 200 cc's, and that showed a little bit of benefit to the patients. And it makes sense, right? You're taking someone else's immune system that fought away, and you're trying to use it for someone else who never saw this virus before. So if you have tested positive before, and if you're healthy, no medical problems, if you're within the age of 19 to 65, and if it's been at least 2 weeks since you last had your symptoms, that's when you can be eligible to donate. People who have, you'll be seeing this a lot in the upcoming weeks, where they're going to be keep asking for donors who have recovered from COVID. Of course, if you've not had a test, it's very hard to tell, and they probably won't take you, but that's why they're trying to also increase the number of tests, so then they can identify the patients who had COVID, and they can potentially donate and help people, and we can all create an immunity together as a community. COVID vaccine, There is a phase one of the trials. What does phase one mean? It means that it's the first stage of a trial for any medication or any new drug that's being made. To get to uh, phase three, that's when you basically say that, hey, this is safe for everybody to use, and we can start giving it to everybody that we know, because we know that it's safe, that it's working, and that no one's had dangerous side effects, and we can now do it on a massive, large scale. So that's where all the trials for the vaccines are. So these are the trials that are ongoing, just so you are aware. And like, if you look out for news and they're updating you on what phase they are, you know the stage of the vaccine. So the Washington state has one. This is based on the SARS and MERS because they're cousins, obviously. So they're using the cousins RNA and seeing like, hey, can we cross attack this new one? China has been using it with adenovirus. It's also a similar virus, and they're using it in a different format. And they're actually starting to think about phase two. So that's the most advanced one that we have now. University of Oxford has a chimpanzee adenovirus that they're trying to work with. And then Philadelphia, Kansas, they are working with the DNA. So clinical trials, like I said, have to reach phase three before everybody gets it. Initially, when it comes out, we might have to prioritize people who really need it versus versus the entire population, because supplies are always going to be limited, just like masks. And because there's so much funding and money directed into this vaccine, these trials are moving fast. And it will probably take, if you ask me, a couple months before we all get to phase three and we start seeing this vaccine being delivered. So that's kind of what I wanted to speak about. Just a few slides on something I wanted to personally say for the whole community. Stay up to date with your state. Every state has a Department of Health website. The CDC it governs the entire country, but every state has a Department of Health. They are regulating the health information for you, updating what you can do, what you can't do. They have a hotline number that you can search. I've just put the New York City's website up here, but whichever state that you're in, you can look up. Even New Jersey has one, and I actually got my parents to enroll in the COVID text service, so they're getting text services on updates on what's going on. They have ways to help if you want to give back to the COVID crisis. Unemployment obviously is an issue, so they have ways listed on helping each other, and also they have ways you can donate to healthcare workers, people who are affected, things like that. So stick to reliable sources is my biggest advice. CDC, Department of Health, talk to physicians directly if you have particular serious questions. The media does blow up a lot of things out of proportion. Of course, the statistics they can lie about, but just don't listen to it all day. Yeah, every day it is increasing or decreasing. New York, the cases have been coming down, the number of hospitalizations, but it's still a pretty widespread pandemic, and it's going to get better. So just focus on the positives. Catch up with friends and family. This is a time that you can do that if you're home. Work on your hobbies, exercise, meditate. Give back to your community, because we're all going through this together, and we are definitely way stronger than this virus together than this virus alone. And last but not least, one of my favorite mentors says, don't just go through the pandemic, grow through the pandemic. So find ways that are going to make you better, not just, but instead of focusing on how can what will I do if I get this virus? How can I stop myself from getting it? What if I die? Instead of that, focus on the positives. Do everything that you need to stay positive. And this is a list of all the resources that I mentioned, disinfection, how to manage symptoms, face masks, everything that I talked about. More details if you want to read about it. These are very, very reliable sources, and I highly recommend. And I just want to thank you for inviting me. Thanks for listening to me and spending your evening with me. I want to thank NAPA for giving me this opportunity to share my knowledge with you, and I will pass it over to the moderators now.
So one thing you have to remember is, as everybody said, prevention is the main important thing. So stay inside, social distancing. And I've seen a lot of, one of my friends, they ask the questions are like, okay, we go out, how are we going to protect yourself? Is wear a mask, of course. And then some people are ordering Instacart, like, they're ordering foods and they're asking how to take care of these vegetables. Some people are washing them in vinegar, soap and water, and then so many different sorts of things. Don't do that. Your vegetables are very sensitive. If you, the things that are supposed to be outside, like, if your packages stuff that can be stay there for 1 day or 1 day outside, though you can leave them outside. But like vegetables, you can just wash them with a lukewarm water and then, cook. The best way to is cooking it at high temperature is the best thing to do it. But don't wash them with soap and water. Okay. And then number 2 is, if you have symptoms, when somebody has symptoms, the tension starts, like, what should I do? Number 1, pick your phone and call your doctor. Or if you don't have an access to doctor, or your doctor closed the office, then the easy thing is, a lot of urgent cares do have a drive-through testing centers. So the best thing is, first is isolate yourself, cover your face with mask, and go to an urgent care center where they can test you, and then come back home, because they're going to be, the results may come in 24 hours to a little bit 72 hours, depending on the center. Not every center has the same results. Once you come back home, you still have to quarantine yourself for 14 days. At least if you know the results, that's okay, because even you have results negative, there is a 70% it's positive, like, it gives you the correct answer. 30% of time, sometimes it may not be the correct result. But still, we would definitely suggest to quarantine yourself, cover your face with the mask, especially the nose and then mouth, and that's the best way to do it. And let me go through the questions here. I have 2 questions I'm going to answer. First one is from Ms. Sudha Bogabatina. She's from Las Vegas. Her question is, her son is traveling from Hyderabad via Mumbai to Atlanta and to Las Vegas. And her question is, does he have to be in quarantine? If yes, when he is in home, I'm not sure if USA is providing any quarantine locations for international travelers. Definitely. So USA is not providing any international travelers quarantine separately. When he comes home, the best way to do is, clean all your clothes and everything separate, quarantine himself, because you sometimes persons may be asymptomatic, so it is tough to know if they're infected or not. So I would definitely suggest for 14 days to keep them in quarantine. If they have symptoms, the best way is to go down to an urgent care or your doctor's office. Ask them, call them before you go, how to deal with the symptoms and where to test it. That will be the best way to do it. I do not think USA has any international travelers quarantine for everyone. Next question is, Madhu, to everyone. Only specific hospitals perform convalescent plasma transfusion, or any hospital that treats can do? If only specific hospitals do it, how can I find those hospitals? So convalescent plasma is a treatment very advanced. That means when patients are very sick in ICU, or when they're not able to get other alternative treatments like remdesivir or not, then the convalescent plasma comes. And convalescent plasma is not a definitive treatment, so most of the institutions may or may not be providing them. Some of the institutions are in clinical trials, they are providing them, so you have to call your local hospitals and find out, because it is tough to know right now, to know which hospitals are providing it or not. And everybody has a different protocol. So even I had a friend who was sick with COVID. She's a physician, and then she was intubated, but the hospital could not provide convalescent plasma. In that case, either only options will be left is, either you have a place that they can provide convalescent plasma, you want to be transferred to have an accepting physician, otherwise continue the same treatment. Because so far, these all trials do have patients who do not get them. Means we do not have a definitive treatment. So we cannot say that, oh, they're not providing the correct treatment, because it is not definitive yet. So I think in all these, I see one more question, and I would let other people take care of it.
Yeah.
So there is a question, can you please send in message? It's vitamin D, how much percent and what is other vitamin D?
Right.
Vitamin D over the counter in a regular basis is for 800 units per day. If somebody who is deficient, usually we go from anywhere from 3,000 to 5,000 units daily. So it depends on each and everyone and their comorbidities. You know, taking vitamin D, which is a fat soluble vitamin, sometimes you do get vitamin D toxicity. So if you want to take as a routine, I would suggest to take 800 to 1,000 units daily. That should be enough for anybody who is trying to be getting prophylaxis right now.
Yeah, so Sabir, the next question is from Rahul. His question is, can you suggest the best way to clean the fresh vegetables and the fruits to get rid of the viruses?
Yes, so there is nothing like, you know, we have any solution that can clean the vegetables and fruits out of the viruses, but Sprouts, Sprouts Farmers Market, it's available online. Sprouts are a part of the Instacart. They do have vegetables disinfecting vegetables where you can actually clean the vegetables and fruits with it. So I'm going to share with you. I have the website. I have the link for that. It's available in Sprouts if you really want to. But as I said, the best way to do is lukewarm water and then cook them properly. Not like eating salad, but you know, cook them properly as an Indian way. That should take care of the viruses.
Good. So the next question in the queue is, please let me know any physicians on the panel doing PCR or rapid test, and if yes, what type of test we are using.
So I can answer that if you want.
Yeah, please.
Yeah. So I'm at Montefiore in New York, and we're using a PCR test for the SARS-CoV-2. And so it's a nasopharyngeal swab, and then we do a PCR. We run a PCR on it. I don't physically do it, but that's what we're testing in our hospital.
Okay. I hope I muted everybody, but someone, okay, that's fine. Okay, so the next question is, how lungs viruses sustain on the fruit and vegetables? And this question is from Madhu. So Sabita or Shanti, anyone, like, you know, just answer. So please unmute yourself and then.
So it is like, you know, it is not about, we are not sure exactly how much long it's going to stay on fruits and vegetables. Like Madhuri presented before, like on surfaces, there are different surfaces where they suggested maybe few hours more exposure. But as I said, the virus, like, you know, when somebody coughs, like, you know, if you're having a delivered person or somebody's coughed on the fruits or vegetables and left, so it lingers onto the, you know, substances for longer time. But we do not have any complete idea how long it's going to stay on the fruits and vegetables. The best way to is, you know, clean them and wash them properly and cook them and eat it. Yeah.
Okay. So the next question, I don't know, there is no name, but he's saying that as our home are becoming offices, schools and restaurants, etc., how do we cope up with the sudden additional unexperienced pressure? Maybe Gumdal, Dr. Gumdal Garu, can you answer this? Can you unmute? Okay. Yeah, I unmuted now. Yeah, go ahead.
As I said, this is a very challenging times because the people who are working, they are working from home, the change of the regular routine structure, and they're also at the same time, they're also responsible for taking care of the children who have to do this e-learning going on. So there is additional pressures. And there are also people that they're worried also about the impending loss of job. So these are various psychosocial stressors that we're exposed to, leading to heightened anxiety, heightened stress. So how do you deal with that? There is no cookie cut answer for this kind of things. There's no quick answer for this. So what we may have to do, we may have to find ways to change some routines. By what I'm saying is, we don't want the kids to be constantly exposed to the media. We don't want ourselves to constantly exposed to the, the TV, because we want to find a way. We can only turn to reliable resources like WHO and things of that nature, rather than getting information from internet and constantly watching that. That puts a lot of stress. So the way to deal with this, you have to find out some routine, having, like I said, having healthy styles like doing exercise, balanced diet, uh, yoga, all these kind of things. We know the studies have shown consistently that these kind of relaxation techniques will help to take off some of the pressure off us. So limiting the exposure to the media, cultivating the healthy lifestyles, able to have breathing exercises, relaxation techniques, or sometimes you can do on video devotional programs, things of that nature. These kind of things, and talking to people who have recovered. So these are the positive coping mechanisms some of us can implement and employ for us to deal with this stress.
Thank you, Dr. Saab. So the next question is from Abhi, and this is
Raj,
specific. Maybe Shanti Garu and can answer
Raj,
this.
Yeah, I can answer
Raj,
this
Yeah.
too.
So yeah,
Raj, this is Anjan. I just want to, 1 second, I want to take time. And
yeah.
on behalf
Go
of
ahead.
NAPA, I would like to thank you all doctors, Dr. Ishwar Garu, Dr. Madhuri, Dr. Shanti Garu, and Dr. Sabita. Thank you very much for all your time, coming forward to help our NAPA community. And also, I am requesting on behalf of NAPA, is there any way, of course, you are always busy people, I cannot ask anything. If anybody, in the case of emergency, if they are not able to reach and they can able to contact you, and is that possibility is there if anybody volunteer, that would be good for our NAPA community people, family members. They will contact only in the case of emergencies. If they don't get any, medical suggestions and they are not able to reach doctors in the emergency conditions, what is the best approach? If you can offer anybody from you among your people, because our community has a lot of doctors too. Thank you for coming already volunteership, and that would be greatly helpful for our moral support for our NAPA families. This is my request from on behalf of NAPA families, and also I would like to thank you for all your time and the best information you provided and best support to NAPA family. You are giving away something to community. That is really great. God bless you. Thank you so much. I would take off and please continue. Thank you.
Thank you, Anjan Garu. So yeah, I mean we can go through that what Anjan Garu has just asked, but I just want to go through this question, some questions, because I know we are running out of time. This question is again from Madhu. Do you recommend vitamin C or zinc 2 be taken proactively? If so, what's the dosage recommended?
Yes, I can answer that question. So the zinc is being studied to improve the symptoms for any viral infections, such as flu. So we are hoping this will help even with this coronavirus. So the doses for zinc is 30 to 40 milligrams per day. So 40, let's say 40 milligrams per day. And then vitamin C, the normal doses usually you take 250 to 1000, but a maximum no more than 2000 per day for vitamin C. And you can take it prophylactically, there is no harm done. But zinc, you don't want to overdo it because that also has toxic levels and it impedes the absorption of other minerals. So you do not want to do that. So if you have a known deficiency, then you have to take a maximum dose of 40. But if you do not, then take a minimum dose of 20 to 30. Okay?
Thank you, Shanti Garu. So this question is from Abhi, and it's like looks like specific. This is
I can answer this one if you want.
the Dr. Vishnu Murthy. So he's saying that may I know the scope of hydroxychloroquine in affected cases and what basis been prescribed, whether on a clinical observation or a pathological basis. So as per Madhu Garu recommended for the treatment for affected cases.
So I can answer this question because I do this every day. Basically, if the patients have oxygen requirements, so if they need supplemental oxygen, that's when we are giving them hydroxychloroquine. Hydroxychloroquine has side effects. It can prolong your the rhythm length of your heart. So the patients who have heart conditions or they already have issues with that rhythm, we try to monitor closely or avoid it. Liver toxicity can cause that. But basically, patients with only moderate to severe symptoms are getting it, not mild symptoms. Patients who can be home, who are okay walking around without oxygen, we are not recommending.
Thank you. Any other questions? I think, I think we are.
Yeah, I would like to add on that one for the hydroxychloroquine. So hydroxychloroquine has its role because of the physiological basis and how it works. As a kidney doctor, I use it a lot for a lot of autoimmune disorders like lupus and many other problems. For hydroxychloroquine, it kind of decreases the virus replication, and it works to, in this process of the corona, they found that it may decrease the progression of the disease. So it's not too much data we have, but this is not for people who are COVID positive and they're at home. These are, as Dr. Madhuri said, these are for the patients who are hospitalized and they're requiring oxygen. So for these patients, we have been giving hydroxychloroquine twice a day, and then they have different regimens. Every hospital has a different regimen for that one. But in those cases, it's helpful. Some people ask me, can I take hydroxychloroquine as prophylaxis? A lot of friends and families from India where they have an access for the hydroxychloroquine. In US, we don't have because it's a prescribed medication. But most of the friends ask me, they're actually taking hydroxychloroquine. So, there is no proven data if it helps to prevent the disease. And also the problems, as Dr. Madhuri said, prolongation of the, heartbeat, which is also dangerous. So you also have to make sure that this is not a medication that you want to take it without having consulting a doctor.
Thank you, Sabita Garu. Thanks a lot. And we're just going around again to see any other questions. So I just saw a question from Chandu. Chandu, I take OTC multivitamin every day. Can I still take vitamin C on top of it?
Chandu, if you're otherwise healthy with no medical issues, just regular over-the-counter vitamins are okay. But if you have any other issues which would cause immunocompromise, such as diabetes, any other autoimmune disorders, then we would recommend. But as I said, you can take vitamin C because it's water soluble. So if daily use is okay. If you can get it from fresh fruits, that's even better. But vitamin C 250,000 should be okay for otherwise healthy folks.
One more thing is a lot of multivitamins have vitamin C in it. So you can flip the bottle over, look through for the vitamin C and look at how many units there are. So if it says 100% of what you need, you're already getting it. So there's no reason to take additional. So just check the labels of what you're taking.
Okay, this is my personal question. I think, this is from my wife. She just told me to ask. So my wife, she's from last 3 weeks, on and off. She's having a throat, I don't know, it's like kind of infection. It's like a itching, but it's coming on and off. And we also called doctor, and he suggested some tablets and also some spray. She's doing that, and it's gone for a week, and then again it started last week. Yesterday, last night. And I don't know if this is due to the weather or whatever, I don't know. But what we need to do, in order to get rid of that 100%. And we are right now, a lot of confusion going on, and we don't know what is that kind of, it's on and off coming.
If she has any previous allergies, if it is definitely an allergy season, it is very confusing at this time. If she has allergies, she can contact a primary to see if she can get antihistamines at this time. She can also do home remedies, which we all know is salt gargling and stuff like that, if she can do. And if she has no temperature, no cough, or any nasal congestion, then she should be okay. It should be sounds like more of an allergy, but definitely she's spoken. A lot of the primary physicians are doing telemedicine, so she can always speak to her primary.
Yeah, I think, yeah, she is right now under medication. So I think she has to.
From her symptoms, if it is just sore, itchiness on and off, it does not seem at least an infectious.
Okay. Thank you, Shanti garu. Yeah, I just see one question from Hari Rahul. This is what he's saying, that can doctors, anyone, what is the status of development of COVID medicine? So basically, it is
I answer
asking
that
like, what is the
question?
next step? Maybe what is the.
So I can comment on it if you want. So the medication for COVID depends on how severe patients are. So like we talked about, if it's moderate to severe, then we are using hydroxychloroquine. So we have medication. Patients are improving on it. They are going home. They are getting better. For patients who have mild symptoms where they don't even need to come to the hospital, there's no need for medication. In terms of patients who are sicker, who are in the ICU or staying in the hospital for a long time, we have trials, ongoing clinical trials that patients can enroll in. It's easy to get there, but other than that, we kind of already spoke about the vaccine and the convalescent plasma that I was talking about. Dr. Sabita actually mentioned, that convalescent plasma takes the sites, not all the sites are doing it, but that's probably one of the best ones that we will have soon as medicine, if you want to call it, or treatment. And then after that, it's really vaccines.
When can we expect the vaccine? One of the questions they're asking. It's vaccine has to be safe. So as Dr. Madhuri said, there are trials, there are phases that has to go through it before you get vaccine. There is a question about maybe next year, by end of the 2021, maybe we will have a vaccine about it. But until then, as like any other respiratory virus, the best thing is prevention and then treatment with antivirals, whatever the information we have. There are ongoing 65 clinical trials, including many of the vitamins, many of the antivirals, as long as monoclonal antibodies, along with the convalescent plasma. So these trials will come. It will take some time, even for the positive and the negative results, or the neutral too. So we just have to sit tight and wait for them.
Thank you, Sabita garu. I think the next question is from Tejashri. To say infection corona may not spread though food, but fruits and vegetables be washed in running water. Person with weak immune system go for canned produce. I don't know what is question, but Sabita garu, can you?
I would not suggest canned food. That's because, if you're already having some immune system problems, canned food has a lot of preservatives that may not go with the problems patients have. Because a lot of my patients are not immune, they do have immunity problems, and then a lot of canned foods do have a lot of salt and phosphorus. There's some lot of preservatives. We definitely suggest not to do it. As I said, it is not transmitted through the fruit or the veggies. It is only, there is a possibility of surface infection. It is not that the fruits and veggies are getting infected. So it's just the superficial surface. As you wash everything, you wash your vegetables, and then cook them and eat them. But I would not suggest to go for canned produce. If you don't have any produce, yes, go for it. But I would not suggest completely to go to the canned or frozen food.
How about frozen food? Adding to the same question.
Yeah, frozen food. If you already have fresh food and you have frozen by yourself, like you did it, you can use them. All of us will use frozen food in and out daily, but doesn't mean that And I think it's most likely the anxiety of the patients who are going through it. If you want to use it, you can use it. It's only for a period of, I'm guessing, for a month to 2 months. But what if this condition goes on for a long time? You don't want to be surviving on the frozen food. So, but I would definitely say it is a surface infection. It is like, surface spread, but it is not a infection of the fruits or vegetables itself. So I would definitely suggest, don't worry, just wash them and cook them properly, and then just eat them.
Cool. Okay, this is my question also. What extent of virus on mail or postal delivery and banknotes?
Madhuri, you want to answer that?
Sure.
No, because
So
this is really important. I mean, everyone now sitting at home ordering some from Amazon and all that, and not only that, we're checking mails. Just really wanted to know how long or how extent the virus is staying on that, and what we need to do, how to prevent anything like that.
So the big study that we know of how many hours it stays on surface is cardboard. So cardboard, they didn't really test paper, but they checked cardboard. It lasts about 24 to 48 hours. So the virus can last on those surfaces for that long. Now, if you practice good prevention, where when you get the mail, you're wearing, you're touching it with your hands, and then you don't put it on a separate surface, have a surface where you're especially opening mail, and then once you're done, you can throw it out and then immediately go wash your hands, so that all the surfaces that came in contact, including your hands, everything's disinfected. So as long as you're washing everything that you came in touch with, the mail and the banknotes, you're good. And then as long as you're not touching your eyes and your face right after you touch your money or the delivery stuff, then you're good to go. But that's how long it can stay on surfaces, basically. So.
Okay, thank you, Madhuri. So the next question, I heard from Indian government that they have an iPhone app and Android app which tracks the infection patients when they approach near you. Do you think the same can suggest to North America government?
Arogya Setu.
I do not think it's going to happen. As having an app is, I think South Korea is the first one who did it. What they did in their government is they had this app where they can track the COVID positive patients to know who they have contacted, and they isolated, quarantined everyone. So it is the government who had it. It is not other people who can see who is positive or negative. Especially with North American government, we are more with HIPAA. That means a patient's having a positive or negative is its own private medical problem. It cannot be displayed for public. So I do not think the app may be coming for other purposes, but I do not think it's going to be public for everybody to know where there is an infected patient walking. And especially in India, I think it's not a good idea to have it publicly, because if you know that that person is having COVID, people start actually, they may isolate them, they may, even have some physical mutilation problems too in India. So I don't think in North America we will have it. Even they have it, they might use for different purpose, but definitely not for public.
Okay. The next question is, there are rumors like coming saying that virus spread in air or ice or something like that. I'm sorry. The virus spread on air. Yeah, the rumors on air, spreading the virus in air. Is it true or false?
Not yet established.
You want me to answer that question? So the virus can stay in air for about 3 hours. So and it can travel up to 6 feet distance. So when someone is coughing or someone is sneezing, yeah, it does stay in air, and then when you pass by, you can get it. But the virus staying in the air is more for patients who are getting intubated for invasive procedures, where everything gets aerosolized, so your droplets are very, very small. I'm not really sure about these rumors. I haven't really heard all of these. We are in the hospital. We're practicing droplet precautions, so we wear a mask and contact. Where if you touch the person who's infected or if they cough on you. That's really the main ways that it's getting transmitted. But the same study which talked about how long it lives on cardboards, they've checked how long it's been in air, and it has stayed for a couple of hours. So it's possible that it's staying in air for longer than we know. And I hope that answers the question.
So what is advice for going a walk outside? I mean,
so you should be wearing a face cloth mask, like I talked about. You can make your own, or and the link, like I'll give you all the slides on how to make it, but you should cover your nose. I mean, the way that you get infected is it gets to the back of your throat if you inhale it. So whether it's in air or not is it's important to know maybe, but it's more important that you're protecting yourself.
okay, thank you.
Hello. Hello.
Yeah.
Can
Who's
you
that?
hear me?
Yes.
Oh, this is one of your audience. No, this is Suvarna from India. I'm a medical person, doctor. Anyway, it's very nice to hear about all these upcomings. One more thing, can this mail some letters and all these things, if you keep it in the UV microwave, is it how long it may take? My son does that very regularly when I ask him to leave it for a day, but he gets them and puts in the microwave for 30 seconds, I think. So how the microwave will help to, probably yes?
Definitely, I would not suggest to microwave anything like that. Microwave does not have any antiviral effects on the food or papers or anything like that. It is not proven. I think it's just for self-satisfaction, but it is not. There is a condition where we do our cell phones, other surfaces are called autoclave, which is not available to the regular people, but this is autoclave, we use it in the hospitals. But I would not suggest to microwave. I don't think it is helpful.
But
I just want to add that so the things that kill COVID are UV light. So that's not obviously microwave. It's a special type of light that you can have in when you get your manicure and they sterilize all that stuff. UV light and then heat, very high temperatures. But microwave doesn't necessarily produce the heat. It's an artificial type. It's a different type of wavelength. So definitely don't recommend using microwave like Dr. Sabita said. But I just want to point out those are the two ways that we are using to sterilize our masks in the hospital.
Okay. Okay. Thank you.
Raj, this is Hari Panapalli. I would like to take a minute while you are waiting for other questions.
Yeah, go ahead, Anna.
Yeah. So thank you so much, all the doctors.
Okay, I think this is really good. I mean, we really spent a lot of very valuable time here, you guys all. Thank you very much. Thanks a lot, and thank you, Madhuri, Shanti, Sabita, and Dr. Ishwar Gumdala garu. Thank you, everyone. I mean, so what I think, if it is required, if like all our extended family, if they want any other session, maybe after a few weeks, we are happy to conduct this kind of sessions again. But yeah, everyone stay home and stay safe. And as I'm showing my NAPA donation thing on the WebEx, I'm sharing the screen. You guys can note down the email address and the donation link. It's very easy. You just log into the napausa.org and click on the donation tab, and as much you can just donate per family. It will be really appreciated. Thank you, everyone. Good night.
Good night. Thank you for having us.
Thank you for having us. Thank you. Good evening.
Good night.
Thank you.
Thank you very much.
I'm going to unmute for a minute for everyone. So yep, just hold on for me.
Thank you all, doctor.
Thank you.
Thanks, everyone.
Thank you all.
Thank you, everyone.